Hi, I'm Cary Funk from the Pew Research Center, where I direct our research on science and society. And I'm here to talk with you today about what we're learning about public opinion and science during this year of the global health pandemic. Scientists and their work are very much center stage, and that's showing us that there is an appetite for information around science, around the science of the disease itself, how it spreads, around public health information, and how public health experts work to help control and mitigate the effects of infectious diseases generally. And we're seeing more information around the scientific process and how research and development works to put new therapeutics on the table, as well as how to develop a vaccine to help prevent the disease. In the U.S., in basically the middle of March, right when the pandemic was, the scope of the pandemic was starting to become clear, what we saw was a moment of unity. We saw almost all Americans saying that these unprecedented restrictions on public activity were necessary. But within about 4 to 6 weeks, center surveys started to show more divide, particularly along political lines. So just for example, we do see Democrats and Republicans generally agree that the coronavirus outbreak poses a major threat to the U.S. economy, but there are wide divisions around the degree of threat it poses to public health. So most Democrats say that the coronavirus outbreak is a major threat to U.S. public health, but fewer than half of Republicans say this, and the share saying this has gone down between April and September. So political divides have come to be really the hallmark of opinion in connection with the pandemic. And these differences are really emblematic of a host of political divides around measures to contain or slow the spread of the disease, whether it be restrictions on activity, whether it be mask wearing or using social distancing. So what we're seeing then are really two broad groups of Americans in society. One that has really that sees a high level of risk, and as a consequence tends to support a number of measures to reduce that risk. And the other group that sees the risk in more moderate terms, more modest terms maybe, and sometimes sees that other group as overreacting. Now, what does this mean for public trust in scientists? As of early May, center surveys found an increase of public confidence in scientists to act in the best interest of the public. And let me just see if I can share that with you so that you can see it directly. And this should be what it looks like. Let me just double check that. And here and here. There you go. So what you're seeing is that half of the people we surveyed were asked about their confidence in medical scientists, and the other half were asked about their confidence in scientists generally. And what we found was that public confidence has gone up in both of these groups. Over really a very short period of time, from December 2019 to May 2020. So the share of the public having a great deal of confidence in medical scientists went from 35% to 43% over this period. And you see a similar uptick in public confidence in scientists generally from 35% to 39%. Now, what we're looking at is that the share of the public with that strongest level of trust or confidence in scientists, it's worth noticing here that you also see close to half of the American public has more of a soft level of trust, saying they have a fair amount of confidence in scientists to act in the best interest of the public. And that means that there's a smaller share that has what you would think of as a negative opinion about scientists, saying that they have not too much or no confidence at all in this group. Now, that's not the whole story. As it turns out, this uptick in confidence is limited to Democrats and not Republicans. So what you're seeing is this increase in public confidence is occurring among Democrats, whereas public confidence in scientists has stayed about the same among Republicans. And this is noteworthy for a couple of reasons. One is that we don't see this kind of uptick in public confidence across the board. The rise in confidence in scientists really stands out, particularly in comparison with the generally low levels of trust in government and other institutions. And it's also worth noticing that this political division over confidence in medical scientists is a new development. We haven't seen that in earlier surveys. Now, even with this increased political division around trust in scientists, I do want to make it clear that you still see broad-based support among Americans of all political stripes over the idea that science tends to bring benefits to society, over the idea that there's value for the country in being a world leader in scientific achievements, just to give some examples. But these new political divisions are important, because a politically divided landscape means that science communicators will need to work through ways to help broaden engagement with people who might be more hesitant or even more skeptical about trusting scientists. Now, how long these patterns will last is just something we don't know yet. We're going to be going back to these questions over time to find out.